Okay, so my next video is on the actions of extraocular muscle. Actually, you need to draw this diagram. The levator palpebrae superior oblique with the things which I have taught you before, the origin and insertion and all. Now we are going to the action of the voluntary muscles of eyeball. The axis, you need to write the axis. You need to write the name of the rotation, which name of the movements which a joint or any organ is performing. Okay, so eye is an organ, is a visual organ, so this eyeball is doing certain actions. Okay, so you need to mention the movement name and its axis. So elevation and depression is in transverse axis, adduction and abduction in vertical axis, rotation, that is torsion, is in anteroposterior axis. Transverse axis, vertical axis and anteroposterior axis. Now a trick to remember is that medial rectus, you need to draw this 12 o'clock clock. Okay, and then towards the medial side write medial rectus, towards the lateral side write lateral rectus, towards the superior side write superior rectus and inferior oblique, and towards the lower side write inferior rectus, inferior side write inferior rectus, but along with that write superior oblique. Okay, now medial rectus is related to adduction. What is it related to? Adduction. What is lateral rectus related to? It is related to abduction. So hence inferior oblique and superior oblique will also be related to abduction, and similarly superior rectus and inferior rectus will also be related to adduction. Okay, now as you can see, superior oblique is also related to abduction, inferior oblique abduction, superior rectus adduction, inferior rectus adduction, and then medial rectus adduction, lateral rectus abduction. Okay, so that is done. Now comes elevation. Now the ones which you have written above is elevation. So superior rectus and inferior oblique is elevation, elevation, elevation. Now what you have written down is depression, superior oblique and inferior rectus, that is depression, depression. Now comes extorsion and intorsion. When you are moving in the clockwise direction, it is intorsion. When we are moving in anti-clockwise direction, it is extorsion. Okay, it is extorsion. So this is towards this side. This is towards this side. So superior rectus will be intorsion. Inferior rectus will be, inferior oblique will be extorsion. Okay. Sorry. What did I just write? Sorry. This will be on this side and this is over this side. Superior oblique is, yeah, superior oblique is extorsion. Okay, this is intorsion, this is extorsion. Inferior rectus is in extorsion, superior rectus is intorsion. Okay, this is extorsion. So this would be intorsion and this would be extorsion. Okay, intorsion, extorsion, intorsion, extorsion. I, E, I, E. I, you write I here, then the opposite one would be E. If you write E here, this one will be I. Do that. Okay, then comes levator palpebrae superioris and then its clinical correlation. I'll be doing that in the next video.